15 total Colts players are on the COVID-19 list. That includes Colts quarterback Carson Wentz. Now, some of those players on that list, though, are vaccinated and could return in the next few days. Now, as far as Wentz is concerned, he could be back soon, too. He just has to stay asymptomatic and pass other testing rubrics determined by the league. Now, we talked to head coach Frank Reich about the COVID situation that every team in the league is dealing with. Here's what he had to say.
This is what we prepare for, for hitting adversity like this, things you don't expect. But this is probably in the category of something that we could expect, and that it would just be a matter of time before it was going to hit us. So we just need to continue to focus at a very high level. Can't allow this to be a distraction, understand how important it is, and let's just stay focused on what we have to do.
Now, all eyes will be on the list of players for Sunday's matchup against Oakland to see if Wentz will be able to take the field. Well, the NFL has changed their policy on COVID-19 quarantine. It's scaled it back after the CDC recommendation. Now, the league says vaccination and unvaccinated players will isolate for 5 days after a positive test, but they can only stop isolating if after 5 days they are asymptomatic or at least demonstrate that symptoms are resolving. And meanwhile, IU men's basketball game scheduled for today has been canceled due to COVID-19. They were set to play UNC Asheville, and it will not be rescheduled. IU didn't say whether any Hoosiers were positive or that it was due to the university protocols. Now, they'll be back on the court Sunday against Penn State. And today we are getting an update from state health leaders on COVID cases here in Indiana. That news conference starts at 2:30, and we will have a crew covering it for you. And we'll also bring you updates right here on 13 News at 5 and 6 o'clock tonight. Well, locally, hospitals are warning that beds are filling up, and not just with COVID patients. It's the same story across the country. The widespread surge is straining healthcare systems and workers. As Liz McLaughlin discovered, doctors say the Omicron variant and this latest surge is hitting unvaccinated Americans the hardest.
A coronavirus milestone health officials were dreading. The U.S. now surpassing its record for daily coronavirus cases, topping 267,000. The unprecedented numbers come as officials cut the recommended isolation time for those who test positive from 10 days to 5 if they're asymptomatic and wear a mask.
Unlike before, our staff was not as easily infected like now. We have more staff now that is being infected.
New guidance that could bring workers back sooner in the hardest hit industries, including healthcare. The Omicron and Delta variants have converged to push the steep rise in cases. The CDC now adjusting its estimate of Omicron's prevalence to roughly 59% of cases, down from 73%, showing the challenge of tracking the fast-spreading variant and the danger Delta still brings to patients.
Almost all the cases we've seen that have been sequenced across here that would be accounting for these hospitalizations are Delta.
Testing challenges continue across the country, with long lines and at-home test kits sold out. Some getting creative in response to the increased demand, including this Miami Zoo turned testing site. Officials continue to plead to the tens of millions of Americans still unvaccinated and most vulnerable to severe illness.
Almost everyone's unvaccinated. If you're vaccinated, you don't meet me.
A scramble to stop the spread as a third year of the pandemic looms. Liz McLaughlin, NBC News, Washington.
Omicron became the U.S.'s top variant less than a month after it was first reported to the World Health Organization. Some of those who are testing positive are people who are already fully vaccinated, leading to questions like these on Twitter, wondering if Omicron is somehow targeting vaccinated people. So let's verify. Can the Omicron variant specifically target a vaccinated person? Our sources are the Centers for Disease Control and Prevention, the WHO, and Dr. Paul Benash, a virologist with Rockefeller University. All of our experts say viruses are incapable of targeting people. What makes Omicron different than other variants is its ability to evade some antibodies that are produced when a person gets vaccinated.
This is really the product of viral evolution. And the virus has evolved to evade the antibodies that it encounters in individuals, and also to transmit from individual to individual more efficiently.
The CDC and WHO call this immune evasion. Omicron is also highly transmissible and came about just as people began gathering indoors again, which is partially why it's spreading so quickly.
It's sort of an arms race between virus and antibodies. The antibodies are learning to bind tighter and tighter to the original virus and all the viral variants that they encounter. And at the same time, the virus is trying to evolve to avoid being bound by these antibodies.
So, no, there's no evidence Omicron is specifically targeting vaccinated people. Public health officials say being vaccinated and boosted provides greater protection against severe illness and hospitalization. It also helps reduce the likelihood of someone spreading COVID-19, but does not eliminate the risk entirely. The CDC says people who are unvaccinated have a higher risk of testing positive and dying from COVID-19. With your Verify, I'm Brandon Lewis.